So this is a talk of Dr. Saurabh Chaudhary. Because of his ill health, he is unable to come. I'm taking this, and just to complete this, and there is no financial interest. And we have discussed this that toric IOLs and marking is very important. Traditional method, manual marking. Latest technology for toric IOL is the digital marking system, and to increase the accuracy, which is very important. This is a bubble marker which we have used, we have demonstrated also. Pre-operative marking challenges we have discussed earlier, and mark can be broad. So these are the new systems which are image guided. IntelliAccess L system, Varion system, I will be taking it further. So this is with the LENSAR femtosecond laser system. This marks the axis which has to be implanted during the surgery beforehand, before when we do the capsular access and the laser femtosecond laser surgery, and this marks on the anterior capsule in the periphery, and that marks remains, and we can check it, the alignment, even in the post-operative period, because this mark is permanently there on the anterior capsule, which you can see here. There is a small video clip. This is not of this is provided by the company, although we have marked the incision by. This is where the mark is present on the anterior capsule, and it is aligned to it. So Harkstride comes with the iSuite toric planner. The planner is a part of Harkstride's T-cone toric platform. The T-cone toric platform complements the LensStar's comprehensive measurement system. LensStar is like an power calculation system, and with 11 rings Placido topography. So toric IOL calculation is accomplished with the integrated Barrett's toric calculator. So this is the similar way we have to mark it pre-operatively. We have to plan the operation using high resolution eye images, which allows the user to define additional guiding lines to anatomical landmarks that will be recognizable in the intraoperative view. So means this takes the picture, it recognizes the pits and the limbus marks vessels, and then they make the axis where these marks are there, they are aligned with 90 and 180 degree, and according to that you plan your power, and because the reference marks are aligned with this. So another one is Osher toric alignment system. It is the similar system as you can see on the slit lamp. This is how toric alignment is done. This image is brought into the operation room on a USB drive or as a hard copy photograph for reference during the IOL alignment, because it marks the pits and the blood vessels and any nevi on the iris, and this will tell us, this will guide us where to implant the lens, and then this picture is taken in the OR, and then the lens is aligned on that particular axis, because these predetermined axes are with us. So a variant guided system we have already discussed. This has three parts: reference unit, which is lying outside the operation room, which takes corneal power. The good part is that with this you can see the apart from the toric IOL, you get the capsular axis also mark, which can be seen during the surgery, and it will guide us to the perfect capsular axis. It takes corneal power measurement, captures a high resolution reference image, and registration and tracking, and detects scleral vessels as well as the limbus, the pupil and iris features, identifies steep axis and projects it on the picture of the eye, and then this image is transferred inside by the Wi-Fi system, and you don't have to carry it and use the pen drive or something, and this is supported inside the microscope, and in one optic of the eye you get an image where we have to intended axis is, where the reference axis are. So and this supports all the type of microscope, whether it is Zeiss, Leica, Moller Whittle, Takagi, Topcon, or any microscope. So this guides us. You can see here the surgery, and you can do the capsular access of the desired size, maybe 5 millimeter, 5.2 millimeter, and or 4.8 millimeter, and this can be you can take a help of this guide system, and then you can do phacoemulsification. After doing phacoemulsification, the lens is implanted, and the IOL, as we have demonstrated earlier, centration is done, and because the Purkinje images of the microscope are there and the axis is there, which doesn't have any marks on the, and this can be aligned, the IOL can be aligned to the internet axis, and this is very, very accurate. I believe it is very, very accurate. So it is precise. It helps guide in precise incision, and I am now doing it all my cases. For if I have to do, if is less than 1 diopter astigmatism is there, then we plan a steep meridian incision, or we can plan a opposite clear corneal incision based on this image guided system. Other this thing is ORA, which is expensive optiware refractive analysis. It uses wavefront aberrometry. It is present in the microscope, and in the measurement and analysis of the refractive power of the eye, as you can see in the video bottom there. So continuous refractive power and magnitude is demonstrated, including the axis and of the sphere, cylinder, and axis, and it's a real-time intraoperative refractometer plus a working algorithm supports by large clinical database. To summarize, present-day manual marking systems are not very precise. Image-guided systems can improve intraoperative precision and post-op predictability in cataract surgery and enhance optical results with the toric IOLs. That is really helpful. And we should under-promise. This is what my personal experience is, that we should always under-promise, that we don't promise that your distance vision you will not require, because many a times you require some cylindrical power, and but definitely your power will be decreased and you will require less, and start doing it when it is more than 2 diopters of astigmatism. Another system is from the Carl Zeiss, the Callisto suit system. It is of the similar type as the Varion, and Ingenuity is something different now, which is a 3D system by which you get a 3D picture on the monitor. Then with the True Guide system from Ingenuity, you get to mark the axis, and this is better, as has been reported by them, because it uses auto registration with a pre-operative image and a 3D eye tracking that helps to eliminate parallax errors during the alignment post-operatively or intraoperatively. And touchscreen capability at the microscope enables surgeons to change toric IOL alignment, incision parameters, and targeted astigmatism outcomes at any time. The system is compatible with any surgical microscope. So this is how it can be used. So other markers are also available, but I don't know where they are and how commonly they are used. But recently, our Indian doctors have also made some apps on the mobile, which can also be used for the pre-operative marking, and then you take this and fix it on the microscope and align the IOL with the pre-operative marking or the pre-operative photograph which you have taken, and these apps are really helpful to mark pre-operatively and intraoperatively, and this is how we can use this system. They are expensive, but they are useful.